The latest news, updates, and more from the world of health and medicine. This is Medical Minutes with Wish TV's medical reporter, Dr. Mary Gillis.
From Wish TV, I'm medical reporter Dr. Mary Gillis, and this is Medical Minutes on the All Indiana Podcast Network. The coronavirus pandemic has turned the world upside down. It's been a year of loss and suffering. However, it's also been a year of incredible discovery and strength. In this week's episode, I speak with Dr. Michael McKenna, pediatrician at Ascension St. Vincent Hospital, who shares what stood out to him most about COVID-19 in 2021. We also discuss the latest results from Pfizer's vaccine clinical trials in toddlers ages 2 to 5 and when this group is expected to be eligible for vaccination. Our conversation is next. We want to know from a pediatrician, your top 3 things that have surprised you, good, bad, about the pandemic in terms of the younger kids, the younger group. So floor is yours.
Sure. Well, all of my surprises are good. First off, I've actually talked about this with a number of my families over the past 6 months to a year, especially as new variants have come in and school changes have happened. You know, when this first started, I was very nervous about kids, and especially all of my kids who had asthma and other chronic illnesses and respiratory illnesses. Are they going to be in really bad shape? And while unfortunately COVID has really been tough for adults, it has been less of a problem for kids. I know certainly the first wave and the second wave, sort of in middle of 2000, late 2000, my friends and colleagues who are working at the children's hospitals here in the city, at Peyton Manning, they didn't have a lot of business going on. And we were thankful for that, because I was really worried that my asthmatics were going to be in really bad shape, and there was going to be a lot of problems for young people like there were for adults. And thankfully that didn't really happen. And even as the different variants have come through, kids have still been relatively protected. Now this summer, it was a little worse than it was when things first started. So I think it's still important for my young people out there 5 and above that can get the COVID vaccine. Go get it. Get your flu shot this year to help make sure you're doubly protected. Wear your masks, wash your hands. But thankfully, things have been relatively better for kids than they have been for adults, certainly. Which leads into step 2, a good surprise. Certainly, when things got shut down initially back in March of 2000 and everybody went to virtual learning, when things tried to open up again in September of 2020 and trying to get back to school, my wife and I both thought, let's hope we get to Labor Day. Let's hope we get to fall break. And things just kept going, like in Zionsville here and Carmel and other places around the state. Elementary schools were in person the whole year round last season. And then certainly we are on task and on track to do that again this year. And the same thing, I know in a lot of schools up here on the north side, and I see patients out from Brownsburg and so forth, there were a lot of schools that were doing, a hybrid, some remote, some in person, and they stayed the whole year. They actually progressed to be where they were in school 4 to 5 days a week. And I was not sure that was going to happen. And it happened because people did a really good job of wearing their masks, washing their hands. And when they were sick, they stayed home. They were really responsible citizens. And I'm really proud of people for doing that. And it just goes to show, just when you think things aren't going all that well in the world, there's a lot of people that are making good choices and working hard to help people out.
And
which then plays into good surprise number 3, which is I would not have necessarily expected 2, 3, 4, 5, 6-year-olds to be really diligent mask wearers. And yes, there have been some that have been more of a problem than others. But I've had a lot of young kids who, even in my office, are super good at wearing their mask, are telling other people to wear their masks. They've been very responsible. They've been very diligent, and they've been very good with themselves and with each other. And so it's been really good to see. And it's another one of those good stories where, you're not sure of how this is going to go. And it went a lot better than I expected, because there's a lot of good people out there, and there's a lot of kids that have good parents, and people are working really hard to make sure that they stay safe and their community stays safe.
Wow, that is quite a list, and I couldn't agree with you more. I'm so glad that as a pediatrician in this younger group, that you've been taken care of this whole time. And right, kids, I mean, this affects you personally with your children and the asthma, which was surprising to me that they would be, I think a paper came out saying that actually they take precautions anyway, so that they were less susceptible. But I don't know, that was just one paper that I read. But right, as a dad, and I know my sister, she has a 3-year-old who they were traveling, and it's like, you have to wear your mask and just be prepared. And he was fine. He was good,
Oh, yes.
So parents, really stepping up, and kids listening to their parents. I don't know what language they use, and sort of like, you're going to be a superhero. I have no idea when you wear this mask.
And there's been a lot of that. Be a superhero, be a star, like some kind of positive noun, basically. Like they've been using that, and kids have been pretty responsive to it. And it's been pretty great.
Yeah. Wow. And then, the infection rate, and then that's just great. Well, so in children, it doesn't affect them as much. I just want to get your sort of perspective on this. And sort of, I understand that there's something right here at the diffusion part of a children. And I read a paper from Yale University scientists that they have sort of gamma interferon and interleukin 6 or 7 right here at their diffusion point. So that makes them less susceptible to the virus to diffuse into the bloodstream. And there's also some sort of, militia in their nose that makes them less susceptible. So it's sort of an explanation, perhaps. And this comes from one study that I read out of Yale University, sort of suggesting that why they're less susceptible. Do you have any reaction to the, sort of the child's physiology?
That certainly sounds possible. I think there is something to be said for being young, and there are a couple of parts to our immune system in kids that are there that we don't have when we're adults. Like, people are surprised all the time when I look in the back of like a teenager's mouth, and I'm like, because they're like, I think I have strep throat. I think my tonsils are all inflamed. And I look in there, I'm like, you don't have any tonsils anymore. And if you look in the back of an adult's throat, most people don't have tonsils anymore. Tonsils are something that go away for the most part over time. There's a couple of other parts of our immune system that are the same way that you have them when you're a kid. And there's this thing called the thymus, which kind of lives right here. I'm going to move my phone. It lives like right here in the neck. Kids have it, and then by about of age 5, it disappears. So it wouldn't surprise me that there are some things that kids have a little bit more robust in terms of the immune system, that's a little more functional, that's a little more, despite the fact that, they come home with every single sniffle and runny nose when they're in kindergarten and preschool. There's something to be said for the fact that they do have a pretty robust immune system, and that it's not shocking to me that scientists have found parts of their immune system that are working especially well, that's really keeping them safe.
Well, the sort of growth in children, I imagine, is just so incredible. What you don't have tonsils, like, and then also the oh gosh, I'm sorry, you had just said it, but I forget my question. But anyway, anything else you want to say about what's been going on? Your hopes moving forward, message to parents, message to kids.
Sure, I think. One, I am really proud of them for working hard, for wearing their masks, for washing their hands, for keeping each other safe, and keeping schools open and functioning. We still have a little bit more work to do. The vaccines for 5 and above has just been available now for, I guess, we're at about 2 months now. If you haven't gotten it yet, go get it. Try to get it before you travel. If not, get it when you come back. Get that flu shot too. It seems like the shot for kids 6 months to 5 years is going to be a little bit delayed. It looks like from Pfizer, their information was they might need an additional dose. So that's going to maybe push approval, hopefully, into more like the late spring, as opposed to we were hoping it was going to be late winter. But, those shots are available. Get those shots, wash those hands, wear those masks. If there's things where you've gotten a little lax, I should say. When I would go to the grocery store for the longest time, I would wear my mask. And then, in the summer and in the fall, I was like, I'm vaccinated. I'm doing fine. I'm going to not wear my mask as much anymore. I've started wearing my mask. Zionsville, our number 1 basketball team, boys basketball, goes Zionsville Eagles. I went to the basketball game 2 weeks ago, and I didn't wear my mask in the building because it wasn't needed. And then when I went on Friday, even though it wasn't required, I was like, you know what? I'm going to put my mask on. There's been places where I think people have been a little like loosening things up. And I think now is the time to let's tighten things up a little bit.
Yeah, no, I'm sort of same way. I'm sort of selective, at times it would be like, I don't need a mask here, but then I'm going to go to the grocery store. I'm going to wear my mask.
Yes.
But and then just while we're talking about this, the data in terms of the 6 months to 5 years old. I mean, so you're saying that maybe not they have to do a little bit more investigation, maybe a little bit more trials, and to see how this is going? And are we talking for Pfizer specifically, it'd be a 2-dose series, but maybe we need a third, or are we talking?
Yeah, the information I just saw from a relatively good resource seemed to indicate that it was the 2 doses was not giving a high enough response to where they felt comfortable with just saying 2 doses. So now it looks like they're going to have to do a 3rd dose, which is not surprising. There are many shots that kids in that age range especially get 3 doses before they're 15 months, for example. You get 3 tetanus shots. Actually, you get 4 tetanus shots. You get 4 pneumonia shots. You get 3 hepatitis shots. There's a lot of cases in that because you're trying to balance. I don't want to give too much of this to kind of shock the system and lead to a lot of side effects, but I don't want to give too little so that they don't get a good response either. So the preliminary data seemed to indicate that it was going to be the 2 doses wasn't enough. So they're now going to have to study 3 doses, which means that it's going to take a little longer for their approval to get, because the FDA and the CDC wanted 6 months of safety data. So it's going to take a little longer for them to get to that point, which means it's going to take a little longer for them to get it approved so that they can give it to the 6-month to 5-year-olds.
Right. So when this comes out, and I'll let you go in just a second, this is so interesting. I mean, this is, and then, so we, parents, that when this does come out, or as they're learning about this sort of the process and where this stands with children, this is, if these should be 3 doses, sometimes it would be like, well, 3 seems excessive, but no, we're talking about tetanus shots. Do you remember when your child got 4 tetanus shots or 3 tetanus shots? Mm-hmm. So it's really just sort of, not something that should be so alarming.
Correct.
And by delaying, it says a lot of good things. We want to test this. We want to make it safe and effective. And we don't know what's going to happen. But, Pfizer and everybody else is doing their job by, being responsible and doing the right thing, safe and effective, right? Well, it can't be effective if it's not safe.
This has been Medical Minutes from Wish TV. I'm medical reporter Dr. Mary Gillis. Be sure to follow and subscribe to this podcast and check out new updates every week. You can also learn more at wishtv.com and when you follow Wish TV on Facebook.
Learn more and get more with Wish TV. Online at wishtv.com and when you follow Wish TV on Facebook. Be sure to check out more great podcasts from the All Indiana Podcast Network now at allindianapodcastnetwork.com.